Despite medical breakthroughs that make it possible for more people to live with cancer than ever before, there are still disparities in cancer care here in the U.S. Get this, according to the American Cancer Society, African Americans have the highest death rate of any racial and ethnic group in the U.S. for most cancers. And here with more about this is Woody, an osteosarcoma survivor and health equity advocate, as well as Shelley Ford Nasso, the CEO of the National Coalition for Cancer Survivorship. Good morning to you both.
Good morning.
Good morning.
Well, we appreciate you bringing this to light with us this morning. Woody, let's start with you. What can you tell us about your journey with cancer and the inequality that you faced in your care?
As a 9-year-old, I was a runner chasing the wind. I noticed on my left thigh a lump, which was subsequently diagnosed as osteosarcoma, which is a rare form of bone cancer. I was treated in a local hospital, and at that time we were in a segregated society. And so I was relegated to the basement along with other black people in what was called the colored ward. So my neighbors in the hospital were women having babies, older people, children, and other folks with infectious diseases. So for 30 long days, I stared at a concrete wall which was without windows. Now, this is over 60 years ago, and now there still exist disparities when it comes to survivorship care.
Well, Woody, I'm sorry I had to hear that story, because just the way that it was and still suffering some of that stuff from today. And Shelley, as I mentioned in the introduction about what we're finding from these statistics and that survey of the state of cancer survivorship, tell us more about that, because what Woody was saying, it's heartbreaking.
Yeah, it is heartbreaking. And I mean, I've heard Woody tell his story before, but it still takes my breath away to hear it. We conducted a survey, our 2021 State of Cancer Survivorship Survey, and we surveyed about 1,100 cancer survivors from across the country, all different races and ethnicities and ages and types of cancer. We want to understand better their experience during and after their cancer treatment. We found that the Black and Latino respondents in our survey were less likely to rate their care as excellent as compared with the white respondents, and they were also less likely to feel respected by their healthcare teams. So we found that there were other disparities in the physical effects, the emotional effects, and the financial effects that different groups suffered from cancer, including young adult cancer survivors, Hispanic, Latino, and people living with advanced and metastatic cancers. And we're grateful to Bristol-Myers Squibb for supporting this survey so that we can share this data about the disparities in access to care.
And speaking for that, Woody, from your story earlier, so then how exactly are you helping create that equitable framework for those living with cancer then after what you experienced?
Well, as a 12-year-old later, I set an intention that I was going to make a difference with whatever life I had left. So I've been involved in fundraising for patient services, for people living with cancer and their families. I also developed a module for health equity that we presented at a local medical center, as well as survivorshiptoday.com.
But both, we appreciate your time this morning and sharing more insight into this, and we will guide viewers into the right direction for that website. So we appreciate your time this morning.
Thank you.
Thank you.
You can learn more about cancer survivorship at survivorshiptoday.com, like Woody mentioned. They have resources for those seeking help, and we'll also have all this information on our website as well.